for visiting us at this critical time when we are dealing with several health challenges in our continent. During our meeting, we discussed a wide range of issues pertaining to the health sector and how to strengthen cooperation between the government of the United Republic of Tanzania and the WHO. I have underscored to the Director General that his visit demonstrates WHO's commitment to a cordial relationship and partnership, which have been growing from strength to strength. Ladies and gentlemen, over the past decades, Tanzania has made significant progress in improving public health. Our focused efforts to reduce maternal mortality have delivered remarkable results, with the rate dropping from 556 to 104 deaths per 100,000 live births. Innovations and initiatives which have strengthened healthcare by investing in the construction of comprehensive emergency and obstetric care facilities, whereby close to 70% of communities can access primary health care services within 5 kilometers. In the same period, we achieved significant reduction in under 5 mortality from 67 to 43% per 1,000 live births. However, there has been a slow reduction in neonatal mortality, which contributes about 50% of overall under 5 mortality. Tanzania aligns with WHO recommendations to establish functional neonatal care units to reach 80% of the district hospitals having the neonatal care units. Last year, we took a significant step towards making healthcare accessible to every citizen by launching the Integrated and Coordinated Community Health Workers Program. This initiative will strengthen preventive health services and basic diseases management at the community levels, with nearly 137,000 community health workers set to be deployed nationwide. Through this expansion, we are improving areas to integrated preventive, promotive, and basic curative health services. Tanzania remains firmly committed to the goal of universal health coverage, a vision we are advancing with the passage of the Universal Health Insurance Act of 2023, which is being implemented. This initiative to increase domestic health financing is an important step in realizing the Abuja Declaration. Our Universal Health Services Coverage Index has already risen from 38 in 2015 to 43 in 2023, a clear indication that community-centered care is at the heart of our health strategy or healthcare strategy. Ladies and gentlemen, you may recall that in recent time there have been rumors pertaining to Marburg virus disease outbreak in Kagera region in northwest Tanzania, over 1,450 kilometers from Dar es Salaam. I wish to inform you that following the rumors, the government took several measures, including investigation of suspected individuals in the concerned areas, working closely with the local community authorities to enhance surveillance, establishing emergency response teams on the ground, and other measures were taken. We also deployed a team of experts to Kagera region on 11th January 2025 to assess the situation and keep the public informed. Laboratory tests conducted at Kabaile Mobile Laboratory in Kagera and later confirmed in Dar es Salaam identified one patient as being infected with the Marburg virus. Fortunately, the remaining suspected patients tested negative with other illnesses. This confirmed case of Marburg virus marks the second outbreak of Marburg virus disease in our country. As you may recall, the first outbreak occurred in March 2023 in the same Kagera region, but it was in Bukoba district. And the epicenter has now shifted to the infected area, Biharamulo district in Kagera. As of today, January 20th, 2025, there have been 25 suspected cases of Marburg who have tested negative, and close follow-up has been ongoing. The cause of earlier reported deaths in the community has not been confirmed, and the efforts are ongoing to ascertain the source of infection. The government appreciates the swift attention accorded by the World Health Organization on the matter and wish to assure everyone that the measures implemented during the first outbreak of 2023, which included quick isolation, treatment of cases, contact tracing, and community engagement, proved highly effective. With the same determination and the use of these proven strategies and resources, we are confident that we will overcome this challenge once again. Ladies and gentlemen, once again, I thank the Director General for this important visit, which has availed us an opportunity to discuss and agree on important health-related matters. Following this visit, we have resolved to reassure the general public in Tanzania and the international community as a whole of our collective determination to address the global health challenges, including the Marburg virus disease, and we have also expressed determination to mobilize resources towards strengthening health systems here in Tanzania. I wish to conclude by underscoring that Tanzania is safe and open for trade and other interactions. We have demonstrated in the past our ability to contain a similar outbreak and are determined to do the same this time around. I thank you once again for taking time to visit us, Director General, and wish you a good stay in Tanzania and a safe trip to Geneva or Davos. Thank you very much. Please, it's your time.
Your Excellency, President Samia Suluhu Hassani, honorable ministers, honorable members of parliament, members of the media, dear colleagues and friends. Habari za mchana. And thank you all for coming today. First, I would like to thank Her Excellency for her hospitality in inviting me to Tanzania, and for her leadership and commitment in promoting and protecting health for her citizens. We have just held a constructive meeting covering a wide range of areas concerning her government's work to strengthen its health system and provide the services needed to advance health for all Tanzanians. And this is a follow-up of our meeting during the G20 meeting in Brazil in November. I commend the President for the investments made in emergency preparedness in recent years. I also recognized Tanzania's successful launch of Universal Health and Preparedness Review Report, which showcases the country's dedication to health system resilience. In addition, I congratulated the President on her commitment to universal health coverage through the enactment of the Universal Health Insurance Act 2023. We also discussed the government's drive to strengthen its health workforce through the launch of Community Health Workers Program in 2023, an initiative that's helping introduce more graduate health workers into the health sector. WHO is proud to have supported Tanzania's creation of new capacities for delivering health services, including in training of health workers. All this and more demonstrates your government's commitment to supporting the health of all Tanzanians, especially women and children, which is evidenced through the reduction in maternal and child mortality. And I again commend you. Her Excellency also updated me on the confirmation today of an outbreak of Marburg virus disease in the northwestern Kagera region. And I pledge WHO's continued support to bringing the outbreak under control. Since the first suspected case of Marburg were reported earlier, Tanzania has scaled up its response by enhancing case detection, setting up treatment centers, and a mobile laboratory for testing samples and deploying national response teams. As you know, Tanzania has gained strong experience in controlling Marburg, as this is the second reported outbreak of the disease in Kagera. The first outbreak, as Her Excellency said, was almost 2 years ago in March 2023, in which a total of 9 cases and 6 deaths were reported. The government's investments in response to the last outbreak has built capacities that I hope will enable Tanzania to bring this latest outbreak under control as soon as possible. To support Tanzania's response, I'm releasing $3 million from the WHO Contingency Fund for Emergencies, and this is in addition to the $50,000 that we contributed earlier to support the initial investigation. At this point, I would like to thank our partners, including the European Union, US government agencies, the United Kingdom, and numerous other national and international health partners for their strong collaboration to work to bring this current outbreak under control under the leadership of the government. Unfortunately, there are not yet any approved treatments or vaccines for Marburg, as you know, although several are in development. But outbreaks can be stopped quickly with proven public health measures to prevent infections and save lives, as Tanzania done in 2023. And considering the low global risk and the strong capabilities of the Tanzanian government, WHO advises against restrictions on trade and travel to the country. And as Her Excellency said, Tanzania is open for business. Now is a time for collaboration and commitment to protecting the health of all people in Tanzania and the region from the risks posed by this disease. WHO, working with its partners under the leadership of the government, is committed to continue to support the government to bring the outbreak under control as soon as possible and to build a healthier, safer, fairer future for all the people of Tanzania. And finally, again, thank you so much, Your Excellency, for your deep commitment to health from the day you started your office. And I assure you that you have our full support. Thank you so much. Asante sana.
Thank you so much, Your Excellency, Madam President and Dr. Tedros. And this marks the end of our session. Asante sana.